it's affected everybody pretty much in the world. So I think this truth, this expose, if you like, of this truth will help people understand that actually, and this is what people like me are doing and people like yourself, and is really to just highlight that this is a system failure. You know, this we've got here by stealth. We've got here because a lot of people don't understand these system failures that they would not find acceptable. For example, why does the FDA take 65% of its funding from the pharmaceutical industry? Why does the regulator in our country, which, by the way, the British Medical Association chair didn't know until I gave a lecture and was shocked when I told him that 86% of the funding of the MHRA in our country comes from pharma? People would find this unacceptable. But that also means there are solutions. There are solutions moving forward where people can feel more confident in the information they're getting. Even doctors is likely to be clean, or as clean as possible, and closer to the truth when it comes to knowing the absolute benefits and harms of medications. So that ultimately means, changing the law, Joe. We've got here because of unethical, unjust, unscientific laws, if you like. And when I look at and trace the roots of it all, this really started, the acceleration of this process started from maybe well-intentioned, I think, neoliberal economic policies adopted by Ronald Reagan in the 80s and Margaret Thatcher in the UK. 1992, I think it was George Bush Sr. that then allowed the FDA to take money from the drug industry. Before that it was essentially through public funding. Academic institutions, most in the UK now get most of their funding from pharma when it comes to medical research. Before, in the 80s, they didn't. So I think when people understand that, John Ioannidis also wrote this great paper a few years ago called How to Survive the Medical Misinformation Mess. And he talks about the fact in the United States, and you spend almost more than $4 trillion on healthcare, 18% of your GDP. He says that 20 to 50% of healthcare activity in the United States is inappropriate, wasteful, and harms patients. Effectively, gives no benefit. And he said one of the reasons for what drives this is that the first thing is most published research, much if not most published research, is unreliable, not useful to policymakers, and not good for patients. But the second bit is most healthcare professionals, most doctors are not aware of this. They're not aware of these system failures, right? Don't make the assumption that your doctor knows about this. And then they lack the critical appraisal skills to understand the evidence and then translate it into a way that patients can understand. And this is part of conditioning. We're not conditioned in medical school to think in these ways, right, about informed consent, about understanding the data properly. It's not rocket, it's not difficult. So there needs to be a shift, as well, culturally. People need to understand that good health in general doesn't come out of a medicine bottle. What determines your health are social conditions, right? The conditions in which we are born, we grow, we live, we age, we work. Understanding the impact of severe psychological stress and how that can shorten your lifespan, right? So, for example, a very good paper published in Nature in 2012 by Elizabeth Blackburn, who was a Nobel Prize winner, and Lisa Epel, a psychologist in California, was called Too Toxic to Ignore. And they talked about the impact of psychological stress on genes that control the aging process and disease. And one of the things that was really startling to me when I looked at it is that if you are a mother of a disabled child, the chronic stress associated with that is the equivalent of 10 years of aging. If you're a victim of severe psychological abuse as a child, or sexual abuse, that can, at the extreme end, knock off 20 years off your lifespan, because the disease process, what happens to the genes, epigenetics, manifests itself later on. I think these things are important to discuss, Joe, as well, because it helps us also try and think about how do we create the conditions in society for everybody where they have an opportunity to be the best version of themselves. And what do I mean by that is have optimization of mental and physical health. Now, that brings me on to, what is health? I'm not a big fan of the World Health Organization these days because I think they've been corrupted by these commercial entities as well, right? Most of their funding now comes with strings attached, according to Margaret Chan, the former Director General of the World Health Organization. Second biggest funder of the World Health Organization, you've talked about this before, Bill Gates. right? Who's heavily invested in pharmaceutical industry stocks, McDonald's and Coca-Cola. So the World Health Organization, unfortunately, are not independent. However, let's say something positive about them. They have this great definition of health: a state of complete mental, physical, and social well-being, not merely the absence of disease or infirmity. So if we start from that place of that definition and understand it, and also realize that you can't have optimal mental health without having optimal physical health, and you can't have optimal physical health without having optimal mental health, because it's interlinked. I think we then branch out and we think about how can we create those conditions so that people have, for example, the right wages. If you're in a low pay, high demand, low control job, the impact on your health is effectively a death sentence. These are the kind of discussions we need to be having. Politically and in the medical establishment and with the public as well.
One of the things